This is the presentation on social and political philosophy. Hi, I'm Vinadeep Kaur. So it is basically on COVID-19 in Black America. That is the third chapter on our textbook. So welcome and thank you for joining me for my video presentation on chapter 3 of Racist, Non-Racist, Anti-Racist by Harper Leland. This chapter delves into the significant influence of COVID-19 epidemic on Black communities in America. I'll talk about the historical background. Leland examined how systematic racism has worsened the effect of the virus on Black communities, resulting in disappropriate impact on their health and social status. Leland started by placing the present situation within the broader historical background of racism in America. He emphasized the long-standing systematic injustice and prejudice that have resulted in structural inequities, rendering Black communities more susceptible to health crises such as COVID-19. Next, I'll talk about the health inequality. This chapter explores the health disparities that persist between the African American and white American populations, attributing them to socioeconomic inequalities, unequal healthcare access, and environmental racism, among other factors. Due to these inequities, African Americans are now more prone to developing pre-existing medical conditions. For example, obesity, diabetes, and hypertension, all of which heighten the likelihood of experiencing severe complications from COVID-19. Leland examined the role of structural obstacles such as inadequate health insurance coverage, restricted availability of high quality healthcare facilities, and racial prejudice in medical care, in perpetuating inequalities in healthcare access for Black Americans. The absence of access has worsened the challenges faced by Black communities in obtaining prompt COVID-19 testing, treatment, and vaccine, and it has greatly effect on the economy. The chapter also examined the monetary effect of the epidemic on Black Americans who are disappropriately employed in critical frontline positions that entail greater vulnerability to the virus. Moreover, lockdowns and economic downturns have a disappropriate impact on Black confirmed, thus worsening existing wealth inequities. Leland further examined the impact of the transition to remote learning within the pandemic of Black students, highlighting how it has worsened uh, educational disparity. This is due to the limited availability of essential equipment and resources needed for online education. This further intensifies pre-existing gap in academic attainment and prospects. Next, I will talk about racism in media. Racism in media coverage of the pandemic has spread harmful assumptions and false information about a Black American, which has led to discrimination and shame. Leland stresses the importance of dealing with these flaws so that reporting is fair and correct. Even though Black communities have so many problems, this part also talk about how strongly and resiliently they were during the pandemic. Leland talks about the community-based and local project. They are trying to help Black America throughout this tough time by giving them support, resources, and lobbying. At the end, overall, chapter 3 of racist, non-racist sensitivities shows how important it is to deal with systematic racism and how it hurts Black Americans' health and well-being during the COVID-19 outbreak. Leland says that fighting racism and supporting policies and actions that are not racist are essential steps towards getting social justice and equal health care for everyone. Thank you so much.